Smoking in public is not allowed in Uganda. In fact, a law enacted in 2015 does not only prohibit public smoking, but also bans tobacco adverts, promotions and sponsorships in the country. Anybody found smoking a cigarette or in any way consuming products that have tobacco content in them, like shisha, while in public will be arrested, arraigned in court and fined 200,000 shillings. One can also be sent to jail for the same, the reasoning being that smokers pose a higher danger to non-smokers than they do to themselves. On several occasions, the law enforcers have promised to crack the whip on people who go against these regulations. However, even when some people have been arrested and shisha pots confiscated, there is not much evidence on the positive implications from the police roundups. And more to that, people still continue to smoke in public. This is because of various reasons, including a lack of resources to effect the law. The recent mobile application, designed in both English and Luganda, is targeted towards providing real-time data on compliance with the law. Tobacco Spotter, which can be accessed on both Android and iOS mobile devices, was developed by the Center for Tobacco Control in Africa and World Health Organization to help formulate reports on the spot towards compliance with the law. Kenneth Bakaira, an IT officer at the Center for Tobacco Control in Africa, says the intention for the app was also to introduce new and efficient ways of collecting data.
It's a crowdsourcing survey. So the tool will help in collecting data from anyone. It can be anyone who has seen the compliance or non-compliance of the Tobacco Control Act. It's easy, it helps, and it's fast, and the data is real time. There is minimal or no errors, and the errors can be easily corrected.
He explains how it works.
When you open a survey, it will locate on the map where you are placed. That means you have to take the survey while you're in that particular place. In this map, it will show you the nearest places, and you can use a filter on the same app to filter different places like private office, universities, bar cafe, public transport, hospital. Then if you want to take a survey, you can actually add a place and then select the type of place, which is a private office, or which can be also indoor offices. So the app basically shows you the list of places and you select. After adding the place, you can take the survey, which is the red button next to the place you've created. Or if it's on the map, then you can add it on using the map. But it's advisable to add on the place exactly where you are, and it uses GPS to locate exactly the place you're in. So when you take the survey, it has a set of questions which are easy to answer, and it will take you 5 to 10 seconds to answer all the questions, and that will be the survey. And then you submit your survey, and it's as simple as that.
The application will be used in 7 countries across all continents, including Seychelles, Uganda, Chile, Romania, Thailand, Pakistan and Mongolia. And here is why.
There are different levels of implementing tobacco control. So we want to learn from that in terms of compliance. If we assess compliance of 7 countries that had a different continuum of tobacco control policy implementation, that will give us a lot of information to learn from.
Nyamurungi says the project with the World Health Organization is a 6-week pilot study.
We're going to have a conventional method, which is the traditional gold standard observation, and then we're going to have the expert review, expanded expert review method, where we're going to increase the number of experts in the field, in the different fields, to assess compliance. So all the 3 methods are going to be reviewed in terms of feasibility, time taken, and the cost. So after that, then we will look at scaling it up.
We are still in the Cancer Week, and the use of tobacco products is considered a major risk factor to cause various cancers, including cancers of the lungs, throat, liver, among others. Globally, it is estimated that smoking leads to the death of more than 8 million people, including 1 million deaths due to second-hand smoke exposure. In Uganda, more than 10,000 people died due to smoking-related illnesses, and about 1,000 others died due to second-hand smoking. While launching the mobile application on Thursday, the World Health Organization representative to Uganda, Dr. Jonas Woldemariam, said Uganda needs to find better ways of implementing its laws.
In other words, the tobacco control law hasn't taken full effect in Uganda. There is still absence of consistent enforcement actions to promote compliance with law and the need for systematic framework for enforcing operations.
He urged the government to keep a keen eye on the shifting trends in the tobacco industry so as to avoid the continued penetration of tobacco products on the market.
And is still banned in a number of countries. The tobacco industry will not rest. The tobacco industry would pour billions of dollars, sufficient enough to fund 10 organizations as big as WHO. Why? For profit. Why? To corrupt reality. Why? To convince us tobacco is safe. Tobacco is not safe.
Walter Mwesije, NTV.